Okay, I am presenting this video of the last 50 of the most common post-COVID-19 symptoms. And again, this is a continuation of my article that has been included in the first 3 videotapes. This is the last one that will be presented. I'm using a different format because the first 50 were, I think, directly related to COVID-19 infection, and so can be attributed directly to COVID-19. The following 50, I don't feel that they are exactly caused directly by COVID-19, but they are probably caused indirectly in the fact that somebody may have had a predisposing condition that allowed COVID-19 to suppress the immune system or some other mechanism and cause the signs and symptoms that we'll be going through. So the next 50 are usually less than 10 or 15% of the population has documented them in the survey, and my report on ResearchGate and academia, which is written, you can read the whole thing in detail, goes through all of the symptoms with a discussion of each. So this is 50 to 100 of the most common COVID or post-COVID-19 signs and symptoms, and a little discussion of each. Now, number 50, most common symptom is feeling irritable. And again, this is non-specific. This could be due to a lot of things, such as lack of sleep, lack of energy, fatigue, or even brain irritability, the mean syndrome that I also wrote articles on, massive epidemic encephalopathic nightmare, MEEN, M-E-E-N. Okay, you can look that up as well on ResearchGate and academia to follow that. I believe it's a real syndrome. I documented it, and other reports support it, even though most people don't yet call it mean. But anyway, number 50, feeling irritable, that could make you mean, literally. And but it could be due to the mean syndrome, post-COVID, encephalopathy. If that is true, you probably should get some treatment for it. Just general short-term irritability might be due to insomnia, lack of sleep, lack of proper diet, other things, fever, just not feeling well, depression, etc. So the short-term, probably fairly common, probably not serious. Long-term, mean, M-E-E-N, that is more serious and causing problems such as the possibly rioting, looting, increased violence, 300% increase in shootings and homicides in some areas. But anyway, let's get on to number 51, which is weight loss. And again, I believe we covered this already. Some of these are somewhat duplicated because the terminology was changed a little, and people complain about this symptom as well. Again, very non-specific and not overly common. Number 52, most common is postnasal drip. And again, this goes along with any coronavirus and also coronavirus COVID-19 infection, which gets the nasal mucosa, causes inflammation, causes increased secretions and mucus, and this can cause a post-nasal drip. Now, the nasal drip was already mentioned, but this is post-nasal. That is, it's going down the back of the person's throat, which can be very irritating and can initiate a cough reflex. So again, this is not too common, but and not specific for coronavirus 19, but a unusual complaint for post-COVID-19 in that it is less than 50% of all cases that were surveyed. Okay, number 53 is dry throat and sore throat. And again, this can be due to viral infection of the pharynx and pharyngitis, viral pharyngitis due to coronavirus 19. And this can last for a long period of time. That's why it's listed as a post-COVID-19 symptom. Number 54, most common symptom, high blood pressure. Again, very non-specific. I don't believe that the COVID virus 19 causes this specifically, but maybe a side effect, complication of just a routine infection with COVID-19. The next one is 55 is dry or peeling skin. So any kind of illness can cause dry and peeling skin. Post-viremia is often associated with peeling skin. So the flu can cause peeling skin. Other viruses can cause peeling skin. So also COVID-19 or post-COVID-19 is associated with dry and peeling skin. Again, not a specific finding. Number 56 on the common symptoms are swollen hands and feet. And again, this may be due to inflammation post-COVID-19 viremia and virus. But if it lasts more than a few days, perhaps you should have a look at it. It could be related to something a little more serious, such as heart failure, sodium retention, water retention, edema, etc. If it's just short term, it may just be due to the virus with the inflammation that goes along with combating the virus from your immune system and inflammatory particles. Excuse me, the deer flies are coming out here. I'm in the middle of nowhere. This is Gold Creek behind me. Very nice, very nice. But there are some flies and insects around here already, even though this is the second warm day that we've had up here. Okay, the next one, 57, heat intolerance. Again, a non-specific symptom. What this means specifically, I'm not quite sure. But anyway, a certain percentage of people under 10 complained of heat intolerance after COVID-19 as a post-COVID-19 symptom. Now again, a lot of this last 50 group are non-specific and may be related to something else, not specifically as a direct result of COVID-19, but as a secondary effect. So I think this may be one of them. The next one, number 58, is mouth sores and sore tongue. Now this can be a direct cause of COVID-19 and other viruses. Can cause lesions in the mouth and lesions on the tongue. And sometimes these are called canker sores. They're exacerbated by spicy food, acidy, citrusy foods can exacerbate it. And they generally are short-lived, last a few days and go away. If not, perhaps you should have them examined and make sure you don't have a secondary infection. which can occur after a viremia and maybe due to virus-induced immune deficiency. Again, long-lasting, get it checked definitely. The next one, number 59, most common symptom post-COVID-19 is neck pain. Now again, we've already mentioned 3 types of back pain, but also part of the spine is the neck, obviously. And again, this seems to be a common occurrence after and during COVID-19, and that is spinal pain. Excuse me. Spinal pain, very common and very non-specific. Could be a viremia causing it. Could be due to myalgias from the virus. Could be due to the immune response from the virus. As your body's trying to fight it, immune complexes are formed and can cause joint and muscle pains and myalgia, arthralgias. And these are usually short-lived. Once the fever goes away, usually they resolve in a few days spontaneously as your body produces antibodies to fight off the virus. If these are long-lived, again, people would worry about myositis, inflammation of the muscles and nerves, arthritis, arthralgias. If they're long-term, you should see a physician to have an evaluation. That is not completely normal after COVID-19. Okay, the next one, number 60, most common symptom of COVID-19 is chills. And again, these are after the virus has finished producing a fever. Your body's not responding with a fever anymore, but some people continue to have chills. And again, a non-specific symptom, it should go away. This number is not related to actual fever, just so you know that. Anyway, the next one is number 61. The notation on the survey was hot blood rushes. Now, I don't know exactly what this means. It could mean several things. Hot flashes, like hormone deficiency, could be like that. But blood rushes also could make me think of like near syncopal episodes, like when you stand up and you may get dizzy, something like that. But again, I think this is non-specific. It's in a low percentage of patients who complained about this, and hopefully is short-lived or short-lived, as some people may say, and goes away and doesn't require a major workup. Okay, I'm gonna switch tapes here for a second. Okay, the next most common post-COVID-19 symptom was number 62 at, quote, phantom smells. Again, an interesting symptom, and I believe what they meant by smells was odors, or the perception of odors, a sense of having an odor or smell, which was apparently probably not present in actuality, but the person perceived this sense of smell, sense of odor that was abnormal. And I would say this is because of the virus, probably directly, and the COVID-19 virus, SARS-CoV-2, it's called, does affect the neurological system. And one of the first places it hits when you absorb it is through the nose, and the ophthalmic nerve is located in the nose, and it hits the ophthalmic nerve, which is a direct extension from the brain through the lacrimal plate, and so the virus can actually travel up into the brain and affect the sensation of smell. So that goes along with anosmia, but this is a slightly different form of it in that the sensation is abnormal. The other time this could occur is when the nerve is regenerating, such as after a case of anosmia or lack of smell after a COVID infection, that when the nerve is regenerating or becoming efficient again, it becomes super sensitive basically, and that part of the brain that controls your sense of smell may feel that it's detecting abnormal smells that perhaps aren't there. Okay, the next most common, number 63, most common post-COVID-19 symptom is bone aches. So these might be similar to arthralgias, that is pain in the joints, but these were actually related to pain in the actual bone, slightly distal to the joints. And again, these are probably a manifestation of some mild nerve involvement usually, and they're usually short-lived and will go away. If not, please see your physician. You may need to see a rheumatologist if these become chronic. Now, if you have inflammation such as redness or swelling along with this pain, definitely see your physician, as this could be something more significant as a post-COVID-19 complication. The next one, in number 64, most common symptom is burning skin. Now again, this could be due to a local reaction of the virus in the skin. Again, people often desquamate or peel their skin after a viral infection, and it can be associated with burning of the skin. But this can also indicate neuropathy, which the virus is known to invade, infect, attack nerves, and the burning is often a symptom of a neuropathy or inflammation or infection of a specific nerve or general nerves if it's all over the body. Okay, the next most common, 65, is pain at the base of the skull. Now this could either be associated with a headache, which is a very common symptom. It was up in the first 10. Or backache, neck ache, which is also up in the first 10 most common symptoms. But for some reason is more localized in this questionnaire to the base of the skull, which is kind of interesting, and could indicate more serious problems if it's long-lasting or very severe, or associated with other neurological signs and symptoms. So keep an eye on it. It's hard to tell if it's the actual brain or skull involved, or if it's the neck. But a small percentage of people reported significant symptoms of pain at the base of the skull. Okay, the next number is 66, that's swollen lymph nodes. Now, swollen lymph nodes, or lymphedema, lymphadenitis, lymphadenopathy, are common with viral infections of many types, including COVID-19. Often the doctor checks for lymph nodes as a sign of infection, and generalized lymphadenopathy or swollen lymph nodes all over the body for a short period of time may be normal from a lot of viral infections, including the SARS-CoV-2, the cause of COVID-19. So if short term, while the person is acutely ill, probably normal and indicates that your body is fighting off the infection by stimulating the immune system, and a lot of the white blood cells are located near your lymph nodes, so that means that your immune system is working to fight the virus. But if this becomes long-term, it should be examined by a physician to see what the problem is. This should not be a long-term problem. That is, the lymph node should not be swollen for, let's say, more than a week, usually. Again, this was a specific symptom to a viral infection, but should be short-term. If it's long-term, go see your physician. Okay, the next number is number 67, most common post-COVID-19 symptom is brain pressure. Now, that's an interesting symptom. This is in addition to one of the most common symptoms that were in the first 10, and most people had a headache. But this was a specific symptom in the last group of, quote, brain pressure, unquote. So how this is differentiated from an actual post-COVID-19 headache, I'm not quite sure. I would put it somewhat in the same group. Perhaps it's related to tension, because when the muscles on the outside of the skull are tense, it's called a tension headache, and that could be related to tension or stress. So perhaps that is what that means. But anyway, a low number of patients, between 5 and 10%, reported, quote, brain pressure as a post-COVID-19 symptom. So anyway, if the headache, what I would call a headache, lasts for more than a few days, or is very severe or debilitating, or associated with other signs or symptoms of neurological problem, then I would again see your physician to have a workup and make sure that there's nothing else happening. Okay, the next most common at number 68 is kidney pain. Now, how the patients know that this is exactly the kidney that is painful, I'm not quite sure. So I would say probably what they were referring to is costovertebral angle pain, which is pain in your flank, the upper part of your flank, which is where kidney pain is referred to. But I'm not sure if most people, unless they've had an actual kidney infection, knows that pain is actually from the kidney. But anyway, the 5 to 10% related to kidney pain as a common post-COVID-19 symptom. Anyway, the significance of this is that it could be back pain, which is one of the most common symptoms, which we discussed previously. It could be a kidney infection or a kidney stone or some other cause. So I would say, unless this just lasts for a few minutes, I would get this checked out. Make sure you don't have a kidney infection. Go to your clinic or your physician. At least get a urinalysis, maybe a culture. Have it evaluated, examined, and make sure you don't have something more significant such as a kidney infection, a kidney stone, or some similar condition. So again, this symptom was kidney pain, and again, that can be specific, but specifically related to as a cause directly from COVID-19. I can't say that, but could be a complication of being immune suppressed or some other complication of secondary from COVID-19. The next most common is number 69, and this was called spikes in the blood pressure. Now again, this is non-specific, and again, I'm not sure if the people were measuring their blood pressure continuously or how they were able to determine they were having spikes in blood pressure, but this was one of the between 5%, 10% most common post-COVID-19 symptoms. Again, non-specific, but if your blood pressure is going high, you're not adequately being controlled, and even spikes are important, can be just as important as a maintained elevated blood pressure. So please get that checked up. You may need some medication, you may need some testing to determine why your blood pressure is elevated. And again, it may be or may not be related directly to COVID-19. Okay, the next most common symptom of post-COVID-19 is number 70, costochondritis. Now again, I would say most patients don't really know what costochondritis is, or probably would not say I have costochondritis. They would say I have chest pain or rib pain or something like that. So this makes me think that they have been diagnosed already by their physician as having costochondritis, and this is a less than 5% common post-COVID-19 symptom, and it does indicate that the person is probably having chest pain and maybe tenderness in the chest wall, tenderness on the rib. So there is some inflammation there. This can be associated directly with the virus. This can be associated with an injury. This can be associated with things like coughing too much. So this can be directly related to the virus and as a complication of the virus. But I would say it also can indicate that there's possibly pneumonia or pneumonitis or some other cause for the chest pain that has been diagnosed as costochondritis. Or let's say it could be even heart pain, myocardial infarction or angina. So chest pain should be taken seriously. And again, as I stated, because it's already been diagnosed as costochondritis, leads me to believe that they have already seen their doctor, who would have ruled out a myocardial infarction or other cause, angina for chest pain. But if it hasn't been ruled out yet, I would say see your physician or go to the emergency and make sure you're not having a heart problem. Okay, the next most common symptom at 71 of post-COVID-19 is hand or wrist pain. Now this is fairly specific. It's a specific area or joints in the body. Why more than other joints? I'm not sure. Maybe they're being used more. The hands and wrists are used usually more than any other joints in the body. Inflammation caused by the virus can occur, and fever and post-COVID-19 symptoms specifically related to just the wrist and hand pain, hopefully are temporary. If they're not, you should be evaluated, especially if there's swelling and redness of those same joints with tenderness. That indicates that there is actually inflammation going on, and it could be something more serious happening. So again, I would get that checked out, especially if it lasts for more than a week, let's say. Get it checked out. Make sure you're not developing arthritis. Yes, please. Okay, the next most common, it's number 72. Interesting symptom noted here on the survey is bulging veins. Now, bulging veins, interesting because if they're in the legs, that may be normal, especially if you're standing up. May indicate you have varicose veins or problem with your the veins in your legs. If they're all over your body, that may indicate something like fluid retention or too much fluid accumulating in your body. So again, a kind of non-specific symptom. If it lasts for a long time, and especially if there's other symptoms associated with it, perhaps have it checked out with your physician. And again, bulging veins, a supposedly common post-COVID-19 sign and symptom. Okay, the next one is number 73, is abnormally low temperature. Now, someone would have to have measured this, I assume, to record a low temperature. That's normally called hypothermia, and normally occurs due to being exposed to low temperature for a prolonged period of time, and usually is resolved by going into a warm place or heating yourself up or exercising, etc., putting more clothing on. I cannot say that this is a significant symptom of post-COVID-19. I would just keep an eye on it unless you're having other signs and symptoms which indicate something more serious going on, to check with your doctor. Perhaps you're anxious and you keep taking your temperature and you note that it's a little bit less than usual. So that would be a sign and symptom of anxiety or depression or tension, making you repeat the temperature frequently and getting a low reading. So I'm not exactly sure what you should do. If you're having other symptoms, obviously it's a problem and you should get it checked out. Okay, the next one is number 74, mid-back pain. Now, we've also had neck pain, headaches, the rest of the spine, but this was a specific symptom of mid-back pain noted as a post-COVID-19 symptom. And what I would say here is this may just go along with the other symptoms of neck and back pain, which usually will go away once your body is healed from the virus. If it doesn't, you should be evaluated. If it becomes chronic, for example, you may have some other conditioning developing, such as an arthritis. But the mid-back, again, is located where your chest is, so I would also worry if you have other symptoms such as cough, shortness of breath, wheezing, coughing up phlegm, especially coughing up colored phlegm that is green, yellow, or brown phlegm. When you cough, then you could have an infection going on inside your lungs and your chest. and that should be evaluated. That could include pneumonia, pneumonitis, pleurisy, and fibrosis can occur after COVID-19 infection. So the mid-back pain by itself, maybe not so significant, but mid-back pain with other symptoms, yes. Please get it checked out.